Next slide, please. Just to say a little bit about our pathways and partnerships, the thing that I want to emphasize here is that at the Child Care Bureau, we serve kids birth to 13 with child care, and we look really at the unique needs of infants and toddlers, preschoolers, and school-age care kids. We do a mixed delivery system because most of the money goes out in vouchers that allows families to choose something that works for them in terms of home-based care or center-based care. And we talk a lot about parental choice in the program. What we want to really focus on is these systems that can, and subsidy money, that can expand parents' access to high-quality choices so that we don't have this either-or between quantity and quality. We're trying to find ways to bring it together because I think, as you could hear in what Inger had to say, that's how parents look at it. Sometimes they have to make trade-offs too, but we should try to find a way to bring it together so that we're expanding the number of high-quality spaces that are available for parents. Next slide, please. Just to say a few words about what we're working on in terms of our pathways, we're working on stronger policies, and I don't want to linger here in the interest of time, but I do need to mention that CCDF, our child care program, is way overdue for reauthorization. That's why we were so excited the President put it in the budget. The administration has put out principles for reauthorization. Quality was really the hallmark of our principles because the law is mainly focused on the work support area now because it's a little bit 15 years old or so. So our principles for reauthorization really put quality first and talked about serving low-income children in safe, healthy, and nurturing settings that promote learning and child development and school readiness. Also talked about expanding high-quality choices available to parents so they can work, and talked also about the continuity of care for kids so that once we get folks in high-quality child care, they can maintain it over time, and every quarter raise doesn't cause them to lose eligibility. That brings me to the second bullet. Even within current law, we're looking at our policies to think about how we could build a child care financial assistance system that is child-focused and family-friendly so that we let people stay on subsidy a little bit longer than they do currently. There is a trend in this direction. For instance, states are reviewing their redetermination policies for eligibility so as to go more toward year-long eligibility instead of 6 months. Right now we're at about half 6 months and half 1 year. In the past, there were many more states that had eligibility redetermination at 6 months or shorter. So we think states are taking up this charge. They're also looking at rates. That's a tough one, of course, because it trades off against the number of kids you can serve. I would note that many states use their ARA money to increase reimbursement rates as an acknowledgement that that was long overdue. Next slide, please. In terms of pathways to excellence, I want to say just a few words about health and safety and then QRIS. One thing that I know for sure is that the health and safety in child care is the foundation of quality, and we particularly want to look at child care licensing, which is far too uneven across the country, both in terms of the standards and how often we can get out and inspect programs, so we're looking at that. But pivoting to what was in the WESC report, we are working here at HHS toward every state with a comprehensive quality rating improvement system that provides a framework for system reform and really supports continuous program improvement with quality. And, we're really putting the focus on the I here, that we want states to think about. They spend $1 billion out of CCDF for quality improvement. And we want to think about, is that $1 billion being spent in a way that has accountability, that we can define where we're trying to take a program, we can make an investment, and then we can see whether or not the provider was able to attain that level of quality. The benchmarking here is HHS has set a high priority performance goal that we will increase the number of states with a high quality QRIS, which means we have to define a high quality QRIS. We've been working, consulting with states and others throughout the summer. We think what we're going to end up with soon here is really a roadmap of here are best practices emerging in this area of QRIS. We'll assess where the states are on them, and then we'll provide intensive technical assistance to states to help them implement QRIS that sort of keep pace with at least the best practice in the field as it currently exists. This field is still very much evolving. And then I think finally I'll just say a few words about providers, because as was eloquently mentioned, and I'm so glad that Inger brought it up, You know, we're talking about a workforce here in terms of child care providers that we need to pay attention to, because this is a big part of women's economic security if we have 1.3 million, mostly female workers, making a low wage that doesn't allow them to support their families. And I actually heard a study somewhere, but I couldn't cite it because I couldn't find it. A recent estimate was that 1/3 of the nation's teacher corps is actually early childhood teachers. So some of the things that we're working on helping states build professional development systems that would include things like career ladders, scholarships to help people move up the career ladder, and also working conditions and compensation. A fair number of states support wage initiatives through their CCDF quality dollars. In the coming year, we're going to try to do a benchmarking type of activity for professional development systems so that we can see what are the best practices in professional development systems around the country, and also help states assess where they are and provide technical assistance for them to move forward on professional development systems. Next slide, please. So that is a lightning tour of where we are in terms of moving forward on quality nationally. Any one of these could obviously have been about a 15 or 20 minute or 1 or 2 hour conversation. I'm hoping this will just be the beginning of a conversation we can have with the partners at the Women's Economic Security Campaign on how we work together on this.